I heard about it my sophomore year, but I didn't get a preceptorship until my junior year. To be able to shadow physicians is sometimes difficult to get into contact with those physicians. I really reached out because I knew I needed the help and I wanted the help to be able to see as much as I could in the medical field and experience that. So you never know who you're going to get paired with, which was kind of exciting because I didn't quite know what specialty I ended up being with. And so, and Dr. Gehring was an gynecologist and obstetrics specialist, and so he, it was a field I never thought I would look into, to be honest, because I wasn't just interested in that area. But after going through it, it was very interesting, and I couldn't possibly see myself in that area. I went to the hospital that he primarily was stationed at, and so just kind of followed him around as I saw patients as they were getting ready to deliver. I also was able to witness some surgeries, whether it involved C-sections, forebirths, or an actual birth. I got to see one of those, which was incredible. Even the C-sections are incredible. You don't get to experience them clearly every day, and so he does, and that was one of my favorite moments, was just seeing an actual baby being born. Even in the two different ways, being able to be seen by a gynecologist is sometimes really scary, but all the patients that I saw, whether they're first time being there or they've been there a million times, they were really great, and they didn't mind that I was there, and they were kind of forward with all for me being there and just learning. And so it was really nice to see. Sometimes there were moments where I got to witness a baby's heartbeat and things like that. So I kind of got to see the whole cycle of being pregnant and how that went all the way to birth, and so that was really interesting. The preceptorship has for sure expanded my medical field knowledge, and that's one thing as a pre-med student that's hard to get. You can't get that in the classroom, and sometimes it's even harder to get outside the classroom and on your own. So that was my first hospital experience, besides volunteering in hospitals, but that was the first time I really got to step in a surgical room of a hospital and be able to walk all the different levels without me being there to visit someone for the first time. It was great just to see that side. So just to experience that was great.